I'm going to turn it over to Sierra.
Everybody, good morning, good afternoon. Welcome to our February virtual office hours. We're really excited today to have Holly Mitchell here with us as our guest speaker. Holly is a community impact director for the American Heart Association, and she is based in West Virginia. And in that role, she works with communities to drive the planning and execution of health impact goals by focusing on identified priority areas that drive equitable health strategies. So I will go ahead and pass it over to you, Holly. Welcome.
Thank you. Thank you so much. And I have been so excited about this presentation because we do a lot of stuff within our communities, as you know, and I love our calls with Regina and the speakers that we have on there too. You're very inspiring. So I'm really excited about this, and it's Heart Month. So happy Heart Month, guys. I'm gonna go ahead and share my screen, and then we will, let's see here. Where is my PowerPoint? Okay. Share. And I'll get back up here. Come on now. I'll go right into it because I know we have a limited time. I just have a few slides, but mostly what I would like to do is have some dialogue and talk about some of the things that we're doing in the American Heart Association, and also some things that you guys can be doing, and your success stories. That's what I want to hear about too. So this is the heart health in the Appalachia. And I remember first hearing that word when I was probably in second grade, because we had Appalachian studies and we all had to say it right. So however you say it is the right way you say it. That's what I learned too. So what I want to do today, and I know you guys know the statistics. I know there's health disparities, but I want to reconfirm and just to remind where we're at, in the grand scheme of things with, compared to United States, and even I'll talk a little bit about West Virginia as well. But to talk about that is always important to see kind of where we're at. And also we're going to be talking about the barriers. And of course, a lot of us share the same barriers. We know this, we have programs that are in need as well. But, to have that frame and to kind of keep it in present, we know what we can talk with. And also we're going to talk about some of the programs that I've done in West Virginia so far, and some of these jewel programs that are amazing, and I'll share the link with you that we can, initiate success with these areas that was just like, oh my gosh, they're called bright spots, and we'll get to that. So let's see. So just a reminder to where Appalachia falls, we're under the umbrella. And I love it. I'm from West Virginia, born and raised. I'm in a little town called Shillian, which is outside of Charleston's where I was from. And that's always going to be home. And West Virginia, I think, is the only state underneath the Appalachian umbrella entirety. So there's no getting around it. We are in Appalachia here. Okay. It's not really responding. Okay. Sorry about that. So just to kind of set the frame to where we're at, not just with hypertension, but some of the other health disparities that we're seeing is 17% higher than the national rate regarding heart disease. In the 8 states that we're talking about all through Appalachia, this was a really great resource too, and I can send you the link. Mortality rate for the Appalachian regional counties is 27% higher than the nationals, and you can read the rest, but it's not any list that we really want to be winners on. Unfortunately, we do have, some highs, but it's not really where we want to be. But I won't bore you with that, but you know where we're at. I also wanted to bring it to your attention, and I'm sure this is on everybody's mind too, especially with women. There is a vast health disparity within women in the United States, but also within Appalachia. And that's going to come in, we're going to talk about other programs that's important, but the women's health movement definitely needs more attention, and we were falling short of that. But I wanted to kind of bring it to light here on this slide. Won't read it to you, but definitely heart disease hits women very, very hard. And minorities. With what Appalachia and our minority population, definitely more resources are needed. I'm not going to read through all the statistics, but I always like to try to, bring this to the attention, because folks like Appalachia or United States, but there's different areas that we really really need to focus on with, and that's why I'm a part of this group, is to help out the minorities. So, okay, so barriers to cardiovascular health and things that might not really occur to you sometimes, like you go day to day, but I try to, when I go to visit some of our clinics, and I try to talk to some of the patients that are in some of our chronic disease programs that we've partnered with. I talk about where they're at, what's it like for you getting in this program, and what are some of the obstacles that you're facing? Lack of space to walk. Who would have thought that would be a barrier, right, guys? Sidewalks. Maybe it's just a 2-lane road and there's no way to get around that guardrail, and you were out in the middle of the road walking, or to work out. Like maybe people don't have a workout room or anything like that. None or unreliable transportation. Even with public transportation, sometimes they only go so far where they can't drop you off at your house. I talked to one of my FQHCs, and this is the craziest thing. They're down in you'll hear me talk about them a lot because they're a jewel to me. The Williamson Health and Wellness Center, they do just so diverse and just robust programs for their community. But one program that they're really trying to do is to get like some type of transportation for their folks around their community. And they have a company down there that they do some transportation to the clinic and here and there, but they don't go over in certain areas because they would have to dip into Kentucky out of West Virginia, and they won't go. And that's a whole, town they're not getting access because it just goes across the river back into West Virginia. How insane is that? I want to call them up right now and be like, I need to speak to your mama so we can get this straightened out, because that's silly. But that's a barrier. So safety concerns too. So if there's really not like well-lit areas, and a lot of older folks and women too, they don't really want to go out. They want to work out. They want to feel safer at home. Limited in knowledge of exercise or nutrition. I got into grad school before I figured out that, I need to burn off more than I take in, to lose weight. And I was in, public health, and I thought, oh, this makes total sense. And, I was a college student. I didn't know anything about that. Limited broadband. This is such a hot topic. Raise your hand if you heard this. Yeah. Broadband, especially after the pandemic, when people were home and they were just like using up all the internet. There is a huge divide in a lot of parts of our country, especially in Appalachia, because we have areas that the Wi-Fi don't go to. I can tell you right now, there's a few places in West Virginia that they're looking at old like stores and like Kmart buildings that they're going to try to put these internet hubs in. But then that goes back to transportation, because you still can't get people to get there to use the Wi-Fi. So that's still a problem. So I know there's some inroads going around about, updating the grid and different things like that. So, but we still haven't had that. I mean, I think we just now got like 5G in West Virginia, and there's still not really any part of it because, as you guys know, without proper, utilities like water, Wi-Fi is one of them, internet's one of them. A lot of businesses won't come and no jobs because of the lack of internet. Also with inadequate housing and affordability, and the housing market is a mess anyway, but if you're low income and you don't have a proper place to live, this is a problem. And we are finding that patients and some of these FQHCs that we've talked with, there's generations folks just living in a house because there's nowhere else to go. 8 people living in like a 2-bedroom house or whatever, it's really hard because they can't move out, they can't afford it. And access to healthcare insurance. Everybody has to have insurance, but it's also about what the coverage is and their understanding of it too. And that's I didn't put this on there, but it's hard for me to understand whatever my policy is, for my insurance, and only time I really understand it is when I'm told something's not covered. And then I'm like, well, I learned the hard way. So, but that's an issue as well, like medical education, with the health insurance. Environmental health issues. This is old news to folks that live in coal camp towns. Coal runoff, unsafe water, unsafe soil to, grow your own garden. Sometimes people don't think about that, but it's like, wow, this isn't really healthy because I'm basically growing my vegetables in coal sludge. That's a big problem a lot of people don't really think about. Also, medical specialists. So not everybody just has to have a GP or PCP or regular old doctor. Sometimes you need extra care, and getting folks that are medical specialists to areas like this is very hard. To get somebody to come in, like a kidney doctor, to go to an FQHC, that's a lot of enticement because they could probably make more money and have a better, life for themselves outside of a big city. And we also know about nutritional, I said desserts, didn't I, instead of deserts? Yeah, I was probably hungry when I was saying this, but you guys know what I mean. Yeah, you can laugh, go ahead. But I was hungry. But nutritional deserts or swamps, we all know about that. No, there's food available, but it's nutritious food. And firsthand, driving around in every nook and cranny in West Virginia, this other job I had, if I didn't pack a lunch, I didn't eat well because there was nothing else around. So that was an eye-opening experience for me. So filling in the gap, pandemic, it brought out the best in some folks and the worst in some folks, and then available services. But telehealth had been like a huge increase. I've seen it even with my own mother, getting telehealth visits and calling in and, putting up her little laptop and, getting her doctor to talk to her about her kidneys. And I was like, man, that is awesome. I would never think that would happen. But this was such a new frontier for a lot of folks like my mother. And again, it goes back to broadband. So that's another barrier. But the national advocacy priority from the American Heart Association is definitely making a push for telehealth. Satellite offices, and you might have heard about these too. You have FQHCs. They have a really great clinic, and they might have like a satellite office nearer to folks who can't get out, and maybe partner with a library or whatever, and they can do it like a couple times a week, or a church or something that they can go out to have a clinic, and it's easier for people to get access. Physician recruitment, huge thing, especially going on, we've talked about with the specialists, but it's a huge improvement to try to get in physician involvement. So they would say, hey, you can do this. We have this type of patient. This is our facility. This is our services that you have, and some success. Transportation, I mentioned the one that doesn't go around the bridge from Kentucky to West Virginia, but there are services all over. I think one of ours called Zip around Charleston. And a lot of this has to do with getting folks to appointments that they need, and also other like legal things that they have to do. There's another one out there too that they try to help us drug rehabilitation services through this. Advocacy work, we do have an advocacy department that's trying to fill in the gaps with some of the things that we can do legislatively to provide services. So I want to talk about a couple of my successes, partnerships with, and we all hear about, hey, this is a really great idea, but what about what we can do here in Appalachia? So this is kind of some examples of things that are like real deal. Hey, this is what's working for what we have here in Appalachia. So we have Valley Health, and I can tell you, if you live in West Virginia, you have seen this Valley Health. They're everywhere. It's an FQHC. They're very robust. They have so many different offerings. There's like 40 plus locations of different things they do. Pharmacy, they even have just areas where people can come in and do applications for SNAP or WIC, women's health, and also school-based health clinics. And now they have 8 dental locations. Now, some of these are standalone, and some of these are actually with other clinics. This is amazing. I talked to him. His name is Brett Wellman. And isn't that a great name for a CEO for an FQHC or clinic? Wellman. He is the bee's knees. He is so nice and just so resourceful. And he's like, yeah, let's do it. Let's try this. Let's see what flies. I'm like, all right. So he has these wonderful dental offices, and he has and here's an important thing too, that could help out a physician or dental champion. And this guy was driving to do like holistic care with some of his patients. And they're finding that, some of these patients were actually seeing their dentist more than they were actually going to like a PCP. So that's twice a year. And, usually you see a doctor, either you're sick or your yearly checkup. So even when I was going to this other dentist, and they do it now, this other one I go to too, but they take your blood pressure. And this was like a huge move to be like, wow, this is kind of cool because, I love my dentist. He was my therapist for a real long time, but he retired. So if you guys want to call me afterwards, that'd be great. But he, he took my blood pressure and I'm like, why are you doing this? He's like, well, and then he explained to me, hey, I see you more than you see your OBGYN, your all this stuff. I was like, wow, that makes so much sense. So there's a lot of data on this that they were tracking blood pressures at dental offices. So some dental work requires you to have a stable blood pressure. And not that it would, like I said, I never had a problem with that. I'm huffing and puffing to get there. Yeah, my blood pressure is probably going to be up a little bit. Know your numbers can kind of get patients more fluent. Hey, you know what that means? And they were educated in this. So this was a really great moment for us. We partnered on other things, and this is a brand new one, collaboration of services. So what's going to happen with these folks, patients, they get their blood pressure taken, maybe the next 6 months, they get their blood pressure taken. Hey, wow, your blood pressure went up. Is there any changes? Hey, and then they do an in-house, because it's the same system. They're going to do an in-house referral for this patient to see a provider for, let's hope that they can get their blood pressure, taken care of. But this is a routine monitoring, and it's just simple as sticking a blood pressure cuff on a patient in a dental chair. So that's one success story. And I hope this is like continuing to grow. But, some dentists, they take it on themselves, but there's no turnaround to continue to monitor because they're not the provider. They're just the dentist. Okay. Is there any questions? Anything in the chat? I thought I saw something pop up, but I just want to make sure. We can always come back to it. Okay. So Williamson Health and Wellness, they have a Fresh Choice program. And this program is for the chronic disease programs that they have with the patients that come in like, okay, you have been diagnosed with diabetes, hypertension, high cholesterol. And this program is definitely holistic care. It's grant funded. It's a one-stop shop. And it's also, it's not just shows, hey, you need to lose weight. Hey, you need to eat healthy. They'll bring these patients in. They'll give them a $20 gift certificate voucher in this program that they can spend on any of the vegetables there. It's kind of like, like a co-op market. They can go in there, but there's also classes. How are you going to cook that squash? Are you going to fry it? Don't fry it. Make it into something else, So that's, to me, that was just such an eye-opening experience because it is not just saying, hey, you need to lose weight. Hey, you need to change, but it's actually teaching them how to do it. And it assists with the nutritional deficits, the deserts also, and it's community centered. A lot of the food is donated or purchased by the FQHC, but it's also going back to the community from local markets that they purchase from. So it's community focused and patient focused. So it's really great. And I think they're going to kick off another part of it in March because they're getting some more equipment. So that's really cool. So the Cabell County Library Hypertension Awareness Program. This is amazing because you have patrons and they kind of did their own little research that they were patrons, but they weren't really patients of anywhere. They weren't, seeing their doctor regularly. They were talking, hey, we need more information about healthcare. A lot of the older population goes there as well. So there's multiple locations. There's about 6 locations, and including some rural locations. And back to rural and metro, there are some areas in West Virginia that we would call them metro areas like Charleston, Huntington, but most are covered with, this is a rural population. So you guys probably know areas where you're from that are like the bigger cities, but they're under the rural umbrella. So they serve over 5,000 patrons a month. That's how many touches they have, people coming in and out of their doors. And there's outreach programs already, like adult education. There's also some other things that they have too, like helping people with their taxes. So this was just a natural fit to go in and start talking about healthy cooking. What's your blood pressure numbers? Because a lot of folks, I don't know what that means. So again, I didn't really want to put them in here, but it was the FQHC is Valley Health. There's actually, and I think this was just a sign because a lot of their branches of the library are next to some of the clinic sites. So the cool thing is that they're going to go in once a month, Valley Health, they're going to sponsor and have this time for community health. They're going to do blood pressure screenings. And this is super important because I'm not a nurse. I don't do blood pressure screenings. The folks at the library, they're librarians. They don't do blood pressure screenings. So this is a clinical piece on a community project. So that's that's the big, huge win here is that the turnaround will be, hey, you've gotten monitored for your blood pressure by a educated, licensed, registered nurse, or community health worker that's been trained. And so there are actually some blood pressure stations to be used, but there's disclaimers going, hey, this is not a diagnosis tool under the library or the American Heart Association or whatever. But when people start wanting to know more about it, we give them the tools and then they can educate themselves about it and then come to the health fairs that they have every third Monday, I think they have this year. So there's also special events planned like cooking demonstrations that we're going to do and special promotions, guest speakers. So this was, again, partnering, collaborating with existing pathways, if you will, of folks that's already going to be going to some of these events. So why do these programs work? They fill the gaps. There are, from the surveys, they have patients that we're not getting any care from anywhere else. It facilitates a need with existing services. So you're kind of marrying services, collaborative funding. And I can tell you, being on several grants, and as you know, most of you have too, that when you put more of effort in there, that you're putting like, I have 2 FQHCs, 2 libraries, and these are how many people we're going to hit, that it actually looks better for you to get the money. Aftercare from the first touch point. So this is important too. And when I was talking about the clinic touch, is that it's not just, hey, we're having a health fair and here's you, good luck, but it's the turnaround. And it's the holistic care that a lot of these folks needs. It's not just, here's what you need to eat. It's, here's what you need to eat. Here's a plate of it. And I want to teach you how to cook it, which I love that part. That's my favorite. I love it that it's hands-on, and I love it that nursing and anybody in the FQHC can actually get involved and volunteer for this too. It's really great. It's the circling back. And it also, when you have like the Fresh Choice program, it's community strengths and values. This lady, you went to church with her, you went to high school, her mom or whatever. And it's the neatest thing because when it's center focused like that with community, patients do better. Okay. Let's see. So I wanted to share with you a little bit of some of our initiatives from the American Heart Association as well. And you can go to heart.org. There are I want to go read all these to you, but there are so many resources available to you. And a lot of them are very, they're free, and they're information or programs that you can kind of pass on. You can get inspired. There's a lot of things on there too, this for, Heart Month. There's also things you can kind of plan out through a year, and they don't really have anything. So we have a youth marketing department as well. So if you have any work with schools, they would love it if you just knock on their door and collaborate with that, because there's so many different things that they do. How many people remember jumping for Heart when they were in high school or elementary school? I'm dating myself. Got these, and you would get pictures taken and you're doing all your jumps, and you could try to get like 100 in, and you got like a sticker or something. Yeah. One of the big things I want to share with you too is what we're doing in West Virginia is water fill stations in schools. As we know, and it's really hard. I don't have my water over here. Shoot. Virginia, you got to get on me with that, because every time I talk to you, I talk about drinking water. I have heard that it's like, if you have it right here in your face, you'll drink it more. But our water fill station bill actually is correlated with, as you're drinking more water, it actually can lower hypertension. So we're trying to get our kids to just drink more water and have that, instilled in their mind. I just remember going to, the water fountain, but we all know water fountains are like super, super clean, right? Ew. Yeah. So some water fountains, they have the water fountain and they have like the fill station, which is actually a little bit, cleaner. So they're doing that in all the schools now. They're trying to get water stations in there and give them water bottles to the students. And we're really proud of that because we know that drinking water, it's other like, maintaining a healthy weight, focus. You're not so tired all the time, no headaches and all this other stuff that you can have, but I'm really proud. Okay. So I'll send these out to you too, but there's for National Heart Month, all these wonderful resources that you can kind of, view, share, get inspired. The theme this Heart Month is to reclaim your rhythm. And I think a lot of people can share in that because after the pandemic, we were all kind of getting out of whack, but this was just super informative and it was really great. And also I wanted to share with you too, know the warning signs of heart attack and stroke for Go Red for Women, especially for women. I'm going to try to find that video and send it to you, but it was, I can't think of her name. It's an actress, but it really is true, especially if you have a bunch of little people in your house that you live and they drive you crazy. And all of a sudden it's like, am I tired? Or is this mom gig that's doing this to me? Or am I really having a heart attack? Because in women, it's totally different. So I really wanted to make sure you guys pay attention to that too, and to look at that. So one more thing, I want to share my screen, and these are called bright spots. Do I have enough time, Regina?
Yeah, plenty of time.
Okay.
This was a 1 hour virtual office hour, and we're just coming up on half an hour. So plenty of
Awesome.
time.
Okay, that's good because I want to kind of go through this and then I want to have some dialogue. So that's good. Okay. So I wanted to show you this really great website, and you might already know about it. It's called Healthandappalachia.org, and they do these wonderful case studies of programs that have just went from not so fab to amazing and more than expected. So I'm going to kind of like, here's Work County. Anybody have they visited Work County before? Okay. Grant County too.
Did you call me? Oh, okay. I can do that. Oh, I'll put it on my calendar. A few hours.
Okay. I wanted to give you guys this is a bright spot, and what they kind of show in, in Work County or in Grant County or some of these other ones is they use this word, which I love. Hang on just a second. I don't want to make you dizzy with me scrolling. Cross-sector collaboration. And that is exactly, before I even started looking at this, a couple weeks ago and trying to prepare for this, I'm like, wow, I was doing that and I didn't even know it really had a name. So this is super great that they're actually using a lot of the resources, and they're going to the FQHCs, they're going to the libraries, they're using farmers markets and things like that. And it's amazing because they're the smallest county in West Virginia and very limited resources. But that's what makes this work, is that they got together, they pulled their resources, and they have this wonderful success because compared to other counties in West Virginia, here they are right here, right in the heart of Appalachia, they're doing better than expected. And that's their catchphrase too, better than expected. So you look at these counties going, this is where they fall in Appalachia, and this is probably, and here's their population, and but then they bring in these programs and it's amazing. So how can I share this with you guys? Let's see, I can put it in the chat. But I definitely want you guys to have this. There we go. And I wanted to bring it up to you guys now to have a discussion about it, because it's not all about me talking, it's about us talking, because you inspire me. So, and anything that I do, if I have more time, I can give you what I'm doing and, my take on things, but I really want to hear from you guys. What are some examples that you can use this cross-sector collaboration? I'm going to stop sharing. Wait. Let me see. Yeah. Stop sharing my screen. Okay. Does anyone want to share some ideas or maybe some takeaways or some programs that you're working with that actually has done this, where they've, combined resources?
I work with the Family Resource Network, and our office is at Valley Park in Hurricane, West Virginia. So we've started a Zumba and cooking class. And so we're having a staff person at the park teaching the Zumba for individuals. And then Anna Hawley, who is actually on the call with us today as well, or Anna, actually does our free cooking classes. So we've had such a great response. Anna's actually started virtual cooking classes in addition to our in-person cooking classes. So again, she does the meal planning, things like that. So again, it's a lot of collaboration, and we're opening it up for free because a lot of people, you talked about barriers. So some families can't afford that $40 for the gym. So the classes are free, and have the families have an opportunity to come and participate.
That's wonderful. So where do you get your funding for that?
We have different funding sources. So the park actually gives us our space rental for free, so we don't have to pay for the space. Then we have different funding grants. So we did get the self-measured blood pressure grant through Marshall University. So we did receive that one. We have a drug-free community grant, also a substance abuse treatment and prevention grant. So we have those that we also provide resources for individuals. And we also just have a bunch of little mini grants as well. So things like Partners in Prevention and all of those. So we pull all of those resources. We were able to just provide goodie bags to all the participants this past class, and everyone got a health and fitness journal. So we're starting a 15-week challenge to teach them healthy meal planning and Zumba and keeping them active and busy. So again, it's a lot of fun. And we start the Zumba at 18 years old. Had people in there that were in their 80s as well this past week. So it's a huge range of individuals, and we just adapt it to whatever the age range is. But again, it's just helping people to stay active in their environment.
Amazing. That is really amazing. I'm so glad that, I asked, because I would have never known. That's a beautiful park. We go there all the time. We bring there, and it's brand spanking new, and I always like the little, whatever you climb one, and I get my kid on there and I can't get her down, and it's amazing that you can actually pull that together. And how many people would you say you have in a class?
It's been ranging. Right now, we set a limit on our cooking class. We're actually we're on a waiting list right now. So that's why Anna, who's actually on the call, Anna started a virtual class now to accommodate that. So, and then with Zumba, it just kind of ranges. We've actually had people just kind of walking by and saying, "Hey, what's going on there?" And
that's so great.
Yeah. So we've had close to 20 now so far in the Zumba class, and we're hoping that will expand as well. We've had a lot of requests for Zumba with the children. Right now it's 18 and older, but we have had requests for younger children because mothers want to come with their kids. So those opportunities as well.
Yeah. Thank you so much. That's amazing.
I've had people from Kentucky and actually a couple from Arizona and a lot in other parts of West Virginia that just can't physically make it to the in-person class, and it fills up so quickly. So that virtual option, the first one is actually in March. So I think that's going to be an even better turnout because it's a healthy option, a healthy alternative, healthy options cooking class. And I think a lot of people just don't have access to it.
That's amazing. Thank you, ladies. Anybody else that want to talk about some of the things that they're doing?
Hi, Holly. I'm Kathy Hill from Boone Memorial Hospital in Madison. And we have had, different programs throughout probably the last 4 years. We've had pharmacy, diabetes prevention, diabetes self-management. We're doing the blood pressure. And it's really come around to cause a big movement here. I'm so excited about this. Our hospital, our CEO has bitten. He understands the importance of wellness and prevention. So they have actually formed a foundation called the Boone Memorial Foundation for Healthy Living. And we're just now getting started with this. And we have been going to meetings with the county commission, the cities, I mean, with everyone, just to spread the word. It's generating a lot of excitement. We're going to be continuing these kinds of projects, the healthy eating, we're putting in a cooking kitchen to teach people how, I mean, I'm just so excited about all of this. It gives me chill bumps to talk about it. We recently opened a fitness center in one of our buildings that we lease from someone, and we now have a gym that everyone that comes to our diabetes prevention or our diabetes self-management, they have access 24 hours a day, 7 days a week to work out in this facility. And so we're really just starting out, but we have so many plans. So, and just being a part of all of this for the past 4 years has just opened my eyes of what people are doing. Otherwise, I think we would have just given up. And listening to you all on meetings like this and networking with people really shows us what can be done. And it's brought a lot to our little tiny area here in Boone County.
Well, thank you, Kathy. And Kathy is one of our partners under, we have a Palatine grant that we're doing the blood pressure cuffs with. And I'll be talking to you soon because we have another order. But
Okay.
Kathy actually said a wonderful thing, which I didn't really talk about, is the buy-in from administration. So you said that your CEO got bitten by the fitness bug or a health bug. That is so important when you have it at a that kind of scale that can go down, and that they can actually make the pathways to make things work for you, and having that partnership. So wonderful. There's so many good things in Boone County. That's awesome. Thank you so much for sharing that. I can't wait to follow up with you afterwards, because you said you just got started. Oh my gosh.
Oh, yes.
There's a lot going on.
Yes, there is.
Cool. Anybody else want to share?
Hi, this is Sandy Burrell. Oh, whoops. I don't know if, hope you all can see me. Anyway, I just wanted to mention right quick that, of course, I'm at the Bureau for Public Health, and we are funded through the 1815 CDC grant, and of course, worked with many of you on this call. And so, our focus has been prediabetes, diabetes, hypertension, and high cholesterol. So we are right now in the process of writing our 5-year plan. This will be the last year of this 5-year grant coming up. And what we are hoping for in the next iteration, the next 5-year grant, is to bring in some new partners and new direction. So please, by all means, start sharing your ideas. If you don't have my contact information, Regina can send it out, or Sheila. But we are looking for new partners and community-based organizations. Of course, CDC is all about health equity, and that's going to continue. So just share your ideas.
Yeah, thank you so much. And that, for us too, the American Heart Association, we love to partner. We know it works. We'd love to, if you reach out and like, hey, I need help with this. Maybe we're not the main focus, but we know somebody else that could help you out with that as well. So I invite you guys to contact me with ideas. We're always looking to partner with newer like FQHCs, especially in Northern West Virginia. We need to kind of do some more outreach out there. So if you know anybody, but Sandra, you are so right about partnering and just sharing ideas, because this is kind of what I wanted to do today, to share a little bit what we're doing, and because everybody knows that, but it's the synergy of, oh, I heard this on a call, and then you follow up with it, and next thing you know, you got a grant. So that's amazing. High five. Okay, anybody else? No.
I know we have some other states represented here. We
Mhm.
have Alabama, looks like, with Sharon, and Janice with Mississippi. And then I believe I saw Mary Beth on here a little bit ago, and she's in Kentucky. I don't see her now, but I was just going to ask, are you guys working with the American Heart Association, doing anything in collaboration with them, Janice or Sharon?
We're not at this time, Sheila.
Sheila, the same for Coosa County. We're not, but I do want to echo to everyone that we are finally not going to be the only county in the state of Alabama without a health department. We got news yesterday that we are getting our health department back. So that is fantastic. That opens up some
Yay.
opportunities for us tremendously. So that is just great news for me.
That is great news. Great news. And I'm talking about rural. I tell you, I've visited Sharon there in Coosa County, Alabama, several times. And honestly, I think it is the ruralest county I have ever been in the Appalachian region. And I have got a lot of miles behind me. So trust me, I've been everywhere.
Hey, Sharon, that's wonderful news. And I invite, if you're not partnered with the American Heart Association, we will get you your contact that covers your state. Or if you want to email me, Regina has my contact information, or I can put it in the chat to get you connected, because as you guys are getting up and running, especially with another health department, I'll just put it in the chat, that we would definitely like to offer anything that we could do to help out. So that's so great.
We have partnered with them in the past, and we've done the Cooking for the Heart, their
yeah.
program that they have there. So I'm very much in tune with the individual over in Birmingham that covers us. So, but it's just a couple of missing factors. And that, like I said, that is a major factor for us. We do have a private source of a health provider in the county. But again, that's, trying to make that linkage and make it work, working with a private source, because they have their set of rules and their set of content of what they are after. So, but we have partnered with them in the past and look forward to some new relationships.
Oh, great. Okay, good. Well, I'm glad that I was going to ask about the other states, if there's any other neighboring states that wanted to talk about what they were doing, or is there anybody else? I think we said Sheila, there was someone from Kentucky.
There was earlier. I don't see Mary Beth on just now. She's in Johnson County, Kentucky. So
Oh, okay.
she's jumped off.
Okay. Well, what I wanted to leave you with after we had some discussion was that, from today, what are some things that maybe your takeaways that you're going to go back, to your jobs with, and maybe talk to some of your folks there in your offices about some next steps maybe that you got from the call.
This is Theresa Mills with the Cabell Huntington Health Department. Hi, Holly. Good to see you. Something that Casey and I talked about. Casey is also with the Cabell Huntington Health Department and a prevention coordinator. We love the idea of bringing and collaborating with the Zumba and the virtual cooking. What a great idea. Even here for our staff, we have a wellness Road to Wellness program, and Casey's in charge of all that. And we just think that is amazing. And who doesn't like to Zumba? It's so fun. Very cool ideas. And thanks for sharing. And I'm glad to be, involved in tobacco prevention with you too, Holly.
Yeah, thank you so much. Nice to see a nice familiar face. And Zumba, that is one little thing, but you could always do other things. Line dancing is this big thing now too. And I am so glad I can have people in front of me, because I have no rhythm, but I'm sweating, and so that's okay. But it's not just Zumba, but I wanted to let you know that there's other things out there, because I was on the call the other night. It was after their business meeting. I did a presentation, and then they actually had virtual line dancing. So there we were, 8 o'clock at night in my kitchen, and I got my sweat on. So that's something else to look forward to. And if you do it for your wellness programs for your employees too, that's a big plus. Oh, yes, yoga. That's a great one, Sheila.
Yeah. Casey's in charge of our wellness. And Casey, not to put you on the spot, you have anything to add? She's fabulous with coming up with new and innovative ideas. And, part of that was Sandy Burrell and the Bureau. We'd like to partner too with them, but not to speak for Casey.
It just reminds me of Dr. Crespo when you say gentle yoga, and all the great things that your office has done, Sheila, with all things wellness. But I think we can really implement some of this for our staff. We've had a lot of turnover, as I'm sure a lot of places have, and we recently did an interest survey, and I think some of these ideas can really be implemented. So we appreciate just the opportunity to be on this and talk with everybody. Thanks.
And thank you, Casey. I think wrapping up, I mean, if you don't have anything that you want to add or take home, but my thing is that there's so much work for us still to do, but there's also a lot of work out there that, we can share with each other, but the ideas, thinking outside the box, Casey, I love that you're just saying anything new. One thing too, I used to work with the Catch My Breath program, which is a vaping cessation program for middle school students. West Virginia is #1 in the country for middle schools and vaping. So it's just catch.org if you want to check it out. It's a free program. We definitely try to get in every school in West Virginia when I was working with the grant. And one thing that we were doing with this grant was that we were giving schools money for health and wellness opportunities programs in their school. But we're like, no football jerseys, no pedometers, no water bottles. Like, come on, think. So a big push that we were kind of looking at and some of the research that we did was that mindfulness, even for adults, if you think about it, yoga, that just really triggered me to think about it, because when have you, like in the middle of the day, can you stop and just give your mind a rest? And it's not about, you don't have to do anything except chill out. So that's what we want to start teaching our young people too, that maybe the stress release that you're feeling, you don't need to grab that vape. You just need to take 5 minutes and learn how to meditate and maybe do some yoga or, have some mindfulness practices. So just wanted to throw that nugget in there. But Regina, I think I'm finished. If there's no other questions, I'll give you 12 minutes back of your life that you can, do some mindfulness with and maybe chill out. So, but is there any other questions before we go? And I can turn it back over to Miss Regina, who is amazing, by the way.
Thank you. I like to acknowledge Sierra, who is our intern on this particular project, for helping us coordinate the virtual office hour. And then I'll just open the floor back up again. Last couple of minutes, if anyone else has anything else they want to share. You can also type your responses in the chat box, and we will make sure to send out all of the resources that Holly shared after today's webinar, and it will also be available on our YouTube page. In the future, it will be available as a distance learning option on the Talent LMS system in partnership with WVU.
Great.
Anything else to add? And thank you so much, Holly. Thank you so much for your partnership and your willingness to be a speaker. And we're just an advocate for health equity and improving health of all West Virginians. So we really thank you and appreciate you for being here today.
Well, thank you so much for this opportunity and connecting with all of you guys again, and especially, the Appalachian family. So I love that.
Okay, well, if no one else has any other comments or questions, we appreciate you participating, and we will see you next month at our next virtual office hour in March, which will have a guest speaker from, who's our guest speaker? Sheila, for March.
It's nutrition. It's Nutrition Month. One of our coalitions, Sarah Barton.
Oh, yeah.
Yes.
Copeland Health
Okay.
Yeah, Copeland Health Systems.
Yes. Yes. So be on the lookout for more information about Nutrition Month. And Sierra will be reaching out to everybody and creating a flyer and all that kind of good stuff. So thanks so much.
Great. Well, thank you guys so much. Enjoy the rest of your day.
All right. Thank you.
Bye.
Bye, everybody.